So, one of the major goals of the UN has been to combat the major diseases impacting the global community. At the time when the MDGs were drafted up in 1990, HIV/AIDS, malaria, and tuberculosis were considered the most urgent of issues to be addressed. Since then, the number of HIV-related deaths has declined and the number of people with the necessary treatment has increased. On the left, you can see that the number of AIDS-related orphans has been decreasing since 2009. Still, the problem is heavily concentrated in sub-Saharan Africa. Millions of orphans still need protection and knowledge of disease prevention is low. The bar graph on the right depicts two things: comprehensive current knowledge of HIV and actual use of condoms during higher risk sex. As you can see, although men are relatively more educated on the issue, the general percentage of awareness remains quite low. Another disease that has been a part of the UN agenda is malaria. If you take a look at the graph on the right, you can see that the proportion of children sleeping under insecticide-treated mosquito nets in some countries in sub-Saharan Africa has increased drastically. As a result of such prevention efforts, the general trend of malaria incidence rate in blue and malaria mortality rate in red has been decreasing steadily since 2000. In fact, the global incidence rate has decreased by 37%. Still, malaria remains a public health challenge, and only 20% of children with fever receive a malaria diagnostic test. Tuberculosis is the third and final disease that was officially a part of the MDG goals. The incidence, mortality, and prevalence rate of tuberculosis has all been falling due to effective prevention, diagnosis, and treatment. As seen in the graph on the left, the incidence and mortality trend has been steadily falling since 1990. Prevalence of TB has especially decreased significantly. In other words, less people have gotten TB or died from it, but TB cases are more concentrated in certain areas. Still, in developing regions where TB poses the highest threat, more than 85% of newly diagnosed cases have been successfully treated for 6 consecutive years, as shown in light blue in the graph. The UN has also tried to attain a certain level of environmental sustainability over the past couple decades. Success has definitely been achieved on many fronts. Just to name a few, net deforestation has slowed, the ozone layer is expected to recover by mid-century, and 91% of the world's population is using an improved water source. But the problems that exist need immediate attention. Global greenhouse gas emissions continue to rise. On the left is a graph of the emission of carbon dioxide. The bars show the extent to which the world as a whole, and especially developing nations, has contributed to global carbon emissions in the past 2.5 decades. Overexploitation of marine fisheries is also rising. On the right is a graph illustrating the current status of marine fisheries. The actual number of fish landings is increasing, but the fish stock within their safe biological limits is decreasing. Loss of biodiversity continues to be a struggle for the world's species. As depicted in this graph, birds, mammals, corals, amphibians, and cycads have all been experiencing a downward trend towards loss of diversity. This has especially been dramatic for corals, as seen in orange on the graph. Although there have been developments regarding basic sanitation and use of improved sanitation facilities, huge disparities exist between rural and urban communities. This graph shows the difference in proportion of population using improved drinking water sources in blue and sanitation facilities in red, in urban and rural populations as well as the world in general. On the left, the darker the blue, the better, and on the right, the lighter the red, the better. As you can see, in urban communities, the leftmost blue and the leftmost red, the colors show a majority of dark blue or light red. However, the world average is brought down significantly by the rural areas. Despite the efforts of the multiple organizations working to improve the realities of the world, unexpected crises and unforeseen problems have impeded progress. Firstly, the 2008 economic crisis severely affected sub-Saharan African countries, especially as many depend on primary commodities for export. The Ebola outbreak affected not only health facilities and factors, but also the number of school-attending children. As many developing countries are agriculture-based, they are vulnerable to natural disasters, which will only worsen due to climate change. Lastly, political instability and conflict has been a major factor affecting all areas concerning the government and citizens. Although these were unexpected problems, valuable lessons regarding crisis management can be learned and applied to future scenarios. Now, Jiyoung will talk more about evidence-based policy.